So I want you to imagine you're looking at a child.
Okay.
And suddenly, out of nowhere, they just drop to the floor. Their muscles lock up entirely, their limbs start violently, like rhythmically jerking, and they are completely unresponsive.
Which is pretty much a nightmare scenario for anyone watching.
Exactly. I mean, your immediate primal instinct is to call 911,
Yeah.
right? Because you're clearly watching a seizure. It's terrifying.
Right. But according to the clinical notes we're looking at today, there is a very high chance you're being completely fooled by the human body.
Which is wild to think about.
It is. It's the, this incredibly dangerous, muddy reality of pediatric neurology. What you just described, it could be a neurological emergency, or it could just be a sudden drop in blood pressure, or a purely psychological response to stress, or, and this is crazy, even just the bizarre quirk of how a newborn sleeps.
And that right there is the entire focus of this deep dive. We're looking at what the sources call epilepsy mimics.
Right, mimics.
These are physical events that look identical to seizures to the untrained eye, but they're completely different under the hood.
Yeah.
And the stakes of getting this wrong are just massive.
Oh, absolutely massive. I mean, if a doctor misdiagnoses one of these mimics as epilepsy, you end up putting a child on heavy, mind-altering anti-epileptic medications.
That they don't even need.
Exactly, that they don't need at all. And on the flip side, if you dismiss a real seizure as just, a fainting spell, a potentially life-threatening brain disorder goes completely untreated.
So our mission today is to decode the highly specific signatures that specialists actually look for to tell the difference.
Because it really comes down to reading the body's hidden language.
Yeah, so let's start with the absolute youngest patients, right? Where parental panic is probably at an all-time high, but the underlying issue is remarkably, completely harmless.
Yeah, the newborns.
Right. We're talking about infants in their very first week of life experiencing this thing called benign neonatal sleep myoclonus.
That is a mouthful.
It really is. What does that actually look like if you're looking into a crib?
So you have a totally healthy, thriving newborn, but suddenly they start exhibiting these bursts of myoclonic movements.
Which means what exactly?
In plain terms, it means quick, shock-like muscle jerks, or they might have clonic movements, which are more of a sustained rhythmic jerking of the arms or legs.
Wow.
Yeah, so to a new parent, it absolutely looks like their baby is having convulsions.
I mean, that would send literally any parent straight to the emergency room in a panic. But the name of the condition itself has a massive clue built right into it.
Right. Sleep myoclonus.
Sleep.
That is the crux of the entire diagnosis. These dramatic, repetitive jerks, they only ever happen when the infant is asleep.
Only when they're asleep.
Only asleep. And they vanish the absolute second the baby wakes up. Like, if the baby is roused even a little, the movements just stop instantly.
Reading that in the sources, it reminded me so much of a computer screensaver.
Oh, how so?
Well, when your computer goes to sleep, this wild, chaotic animation starts bouncing all over the screen. Right. It looks like the machine is working in overdrive.
Right.
But the second you reach out and just jiggle the mouse, the screensaver disappears, the normal desktop pops up, and everything is perfectly fine. Waking the baby up is basically, jiggling the mouse.
I love that analogy because jiggling the mouse proves the computer's underlying hardware is actually perfectly fine. And the same logic applies to the newborn's brain.
Okay.
See, a true epileptic seizure is a massive, disorganized electrical storm firing across the neurons.
Yeah.
That kind of profound electrical event does not care about the boundary between sleep and wakefulness. An electrical storm cannot be instantly switched off just by waking the patient up.
Right. The brain is seizing whether it wants to be awake or not.
Precisely.
Yeah.
So if the rhythmic jerking only happens during sleep and immediately disappears upon waking, that tells a neurologist they are not looking at epilepsy. The condition is entirely benign. It resolves on its own as the baby's nervous system matures over, a few months.
So no meds?
No meds. The only medical intervention needed is literally just reassuring the parents that their child is perfectly safe.
It is so wild to me that the treatment is basically just wake him up and see.
Yeah.
So, okay, that covers a harmless quirk that happens during sleep. But let's shift gears to a child who is wide awake, highly emotional, and just completely melting down.
Yes.
The next mimic involves a phenomenon called a breath-holding spell. And honestly, this one seems way more intense.
It is. These are highly predictable, stereotyped events, usually seen in young boys, roughly between 6 months and 3 years of age.
Okay.
And unlike the newborn sleep jerks, this is fundamentally triggered by behavior and environment.
Yeah, the sequence of events here is just so specific. Like, a toddler is told no, they are denied a toy, or they get incredibly frustrated about something.
As toddlers do.
Right, and they start crying, that
Yeah.
really hard, prolonged wailing, and then they just stop breathing. They hold their breath until they develop cyanosis, which means their skin and lips actually turn blue from a lack of oxygenated blood.
It's terrifying to watch.
And then they go totally limp, and they start having stiffness and rhythmic jerking.
Which, of course, sends the parents into a complete panic because it looks like the emotional meltdown just triggered a massive seizure.
But wait, I really have to push back here on
Okay.
behalf of anyone listening. If the child goes completely limp, turns blue, and starts exhibiting tonic-clonic jerks,
Yeah.
how on earth is a doctor calling that a behavioral issue? I mean, that is the literal definition of a seizure, isn't it?
Well, it really comes down to cause and effect, and specifically the timeline of the symptoms.
The timeline.
Yeah. In true epilepsy, the electrical storm in the brain happens first. That abnormal electricity forces the muscles to seize, and that stiffness might impair the child's breathing.
Okay.
And that impaired breathing eventually causes them to turn blue later in the episode.
So the electricity causes the suffocation.
Yes. But in a breath-holding spell, the order is completely reversed. Oh, I see.
The emotional trigger happens first. The breath holding and the cyanosis, the turning blue that happens second. The jerking movements only happen at the very end.
Wow.
Those movements are not caused by an electrical storm. They are an anoxic reflex.
Anoxic meaning a lack of oxygen.
Correct. The child holds their breath so long that the brain is temporarily starved of oxygen. When the brain senses that lack of oxygen, it triggers a physiological reflex that causes the muscles to jerk.
So the jerking is a secondary reaction to the breath holding.
Exactly. It's not a primary brain disease.
That makes total sense physiologically, but just think about the psychology of the parent in that moment.
Oh, I know.
You see your toddler turn blue and start convulsing just because you took a toy away. The natural instinct is going to be to immediately give the toy back, coddle them, do whatever it takes to stop it from ever happening again.
And clinically speaking, that is the worst possible response.
Yeah. Because diving into the child or showering them with intense attention immediately after the episode, it inadvertently reinforces the behavior.
Oh, no.
The child's brain subconsciously maps out this terrifyingly effective strategy, basically saying, if I hold my breath until I pass out, I get exactly what I want.
That is wild. So the medical advice is to stay calm, make sure they are safe, but absolutely do not give in to the tantrum that started it.
Right.
Which requires nerves of absolute steel. But there is a twist here in the sources that I found completely fascinating.
The iron deficiency.
Yes, we keep calling this a behavioral issue, but there's a hidden physiological problem often driving it, which is a lack of iron in the blood.
Yeah, iron deficiency anemia is strongly correlated with these breath-holding spells. It perfectly illustrates how interconnected our biological systems really are.
But how does low iron make a toddler hold their breath until they jerk? Like, what's the connection?
So, iron plays a critical role in the brain, well beyond just carrying oxygen in the blood. It is essential for the function of certain neurotransmitters, including dopamine.
Okay.
And dopamine helps regulate emotion, behavior, and the autonomic nervous system. So when a child is iron deficient, their neurological threshold for these intense reflexive responses might actually be lowered.
So their baseline is already compromised. A behavioral trigger sparks the crying, and then the low iron might make their autonomic system overreact,
Exactly.
leading to the breath holding and the anoxic jerking. So you can't just discipline the behavior away. You actually have to fix the hematology by giving them iron supplements.
You have to address both. It requires behavioral management from the parents and nutritional management from the pediatrician.
It's just amazing how a lack of oxygen driven by emotion can trick us into seeing a seizure. But oxygen isn't the only fuel the brain can suddenly lose.
Right.
What happens when the heart itself gets tricked into slowing down? That brings us to syncope, which I think most of us just know as fainting.
Yeah, syncope is cardiovascular in origin. The brain isn't producing abnormal electricity, it is simply reacting to a sudden drop in blood delivery.
Okay.
But if a child faints and their limbs twitch, bystanders frequently report it to us as epilepsy.
But the context clues here are very different, aren't they? Syncope usually happens when a child has been standing perfectly still for a long period of time.
Like standing in a choir on risers.
Right, or at a long school assembly. Or it can happen after a sudden, intense fright. And the visual cues on the child's face are distinctly different from the breath-holding spells we just talked about.
Oh, absolutely. You won't see that deep blue cyanosis. Instead, the child will look profoundly pale, often really sweaty or clammy.
Right.
And if you check their pulse, it will be notably slow. This is often driven by the vasovagal nerve, which can suddenly tell the heart to slow down and cause the blood vessels in the legs to widen.
So all the blood just pools in the legs away from the brain.
And the way they fall to the ground tells you everything you need to know.
Uh-huh.
A true generalized seizure usually causes the body to become rigid instantly. The patient drops like a stiff board. But in syncope, because the blood pressure is dropping steadily, the brain gradually loses consciousness.
I think the clinical notes described it as a gradual crumple.
A gradual crumple, yes. The muscle tone releases in stages, so they slump, their knees buckle, and they crumple to the floor.
Like a marionette having its strings slowly loosened one by one.
That's a great way to picture it.
And the mechanics of fixing this are brilliantly simple. It's basically just plumbing, isn't it? The physical posture of the patient is both the clue to what happened and the cure for it.
It really is. When the child is standing upright, the heart is fighting gravity to pump blood up to the brain.
Right.
When that vasovagal response slows the heart rate down, gravity wins. The brain realizes it isn't getting enough fuel, and it forces a shutdown to get horizontal.
It literally makes you pass out so that you fall over, putting your head on the exact same level as your heart.
It is an incredible self-preservation mechanism. By simply lying the child flat or elevating their legs slightly, you remove gravity from the equation.
Wow.
Cerebral blood flow is immediately restored, the brain gets its fuel, and consciousness returns rapidly. There is no prolonged period of confusion like you see after a real seizure.
Okay, so we've covered physical mechanics, we've talked about gravity, oxygen, sleep states, but now we have to move into the most complex mimic of all.
Yeah, this one is tough.
What happens when the trigger isn't physical at all, but purely psychological? We need to talk about psychogenic seizures.
This is deeply complex, and historically it has been heavily stigmatized. It is vital to get this diagnosis right, not just to stop unnecessary seizure medications, but to ensure the child gets urgent psychological intervention.
And these present very differently in the notes.
Yeah.
They are more frequently seen in older adolescents, particularly girls.
Yes.
And the physical movements are often bizarre, like asynchronous thrashing, sometimes pelvic thrusting, or side-to-side head shaking, which isn't typical for the rhythmic, synchronized jerking of true epilepsy.
Not at all.
But the most glaring physical clue is the eyes. They are tightly, forcefully shut.
Right, because in a genuine epileptic seizure, the eyes are almost always open, sometimes rolled back. The brain is short-circuiting, meaning it cannot maintain active, coordinated muscle control.
So keeping your eyes squeezed shut actually requires too much brain power for someone having a real seizure.
Exactly. It requires active, continuous motor resistance. If you try to gently open the eyelids of someone having a psychogenic event, you will actually feel them actively fighting against you to keep them closed.
Oh, wow.
And that active resistance is a huge indicator that the underlying mechanism is not an electrical storm.
But the detail that really stands out to me is something called audience dependence.
Right.
These episodes rarely, if ever, happen when the teenager is entirely alone in their room. They happen in the classroom or in the living room when family is around. So I have to ask the obvious question here.
Go for it.
If a teenager only starts thrashing on the floor when people are watching, and they are actively keeping their eyes squeezed shut, aren't they just faking it to get out of a test or get attention?
See, it is the most common assumption to make, and it is entirely incorrect.
Yeah.
This is not malingering. Malingering is a deliberate, conscious choice to fake an illness for a tangible reward. Psychogenic seizures are a subconscious phenomenon. They often fall under the category of conversion disorder.
Conversion meaning the brain is converting one thing into another.
Yes, converting profound psychological distress into a physical symptom. The patient is dealing with overwhelming trauma, anxiety, or an unbearable stressor.
Okay.
The conscious mind cannot process it, so the brain's subconscious escape hatch is to produce this dramatic physical event. They are not consciously choosing to thrash on the floor.
So they genuinely experience it as a complete loss of control.
Entirely.
The audience dependence isn't them saying, okay, people are watching, time to put on a show. It's more that the social setting itself might be the stressor. Or Their subconscious recognizes that having the episode in front of people forces an immediate change in their environment.
Exactly. The episode forces a pause on whatever unbearable reality they are facing right then. You are treating a child whose brain is crying out for help in a highly physical way.
That distinction just completely changes how you view the patient. You move from frustration to deep empathy.
You do. And we have to highlight a massive, dangerous clinical trap here.
What's that?
A doctor might see the tightly shut eyes, observe the audience dependence, and confidently declare it a psychogenic seizure. But psychogenic seizures can, and frequently do, coexist with real electrical epilepsy in the exact same patient.
Wait, how does that work? Like they have a real electrical seizure on a Tuesday and a stress-induced psychogenic one on a Thursday.
Yes. Because living with a chronic, unpredictable neurological disorder like epilepsy is incredibly traumatizing.
Oh, I bet.
The constant fear of having a seizure can generate so much psychological distress that the brain begins producing psychogenic episodes on top of the organic ones.
It's a vicious cycle. The stress of the disease causes a psychological mimic of the disease.
Which is why you can never use the presence of a psychogenic seizure as an excuse to completely rule out epilepsy. An EEG, which measures the actual brain waves, is often required to ensure you aren't missing a true neurological disorder hiding beneath the psychological trauma.
It really is like peeling an onion where every layer requires a completely different medical specialty.
Seriously.
So we've spent this entire time looking at clues that prove an episode wasn't a seizure. Sleep dependence, cyanosis happening first, slow pulses, closed eyes.
Right.
Let's look at one final clue that does the exact opposite. A sign that proves an episode absolutely was a genuine seizure.
It's the perfect way to close out this diagnostic framework, really. It is a phenomenon known as Todd's palsy.
Todd's palsy. The sources describe it as a transient postictal limb weakness. Let's break that down. Postictal refers to the recovery period immediately following a seizure, right?
Correct.
A child has an episode, and when they wake up, one specific limb, like their right arm or their left leg, is incredibly weak, or sometimes completely paralyzed.
Imagine the terror for a parent there. Your child just had a seizure, and now they wake up looking like they've had a severe stroke.
But the key word here is transient. The paralysis resolves completely on its own, usually within about 24 hours. Why does this happen?
It points directly to a genuine focal seizure. A focal seizure means the electrical storm wasn't generalized across the whole brain. It was highly localized, firing intensely in one specific region.
Okay, so for example, the part of the motor cortex that controls the right arm.
Right. And afterward, those neurons are metabolically exhausted. They have depleted all their energy reserves and literally shut down to recharge. That localized brain exhaustion manifests as temporary paralysis in the arm.
The hardware needs to reboot.
Exactly. The presence of Todd's palsy tells a neurologist two crucial things. First, a real electrical seizure definitely just happened.
Yeah.
And second, it tells them roughly where in the brain the short circuit originated based on which limb is actually weak.
It's incredible. Todd's palsy points directly at epilepsy, while everything else we've discussed points away from it.
Yep.
It really gives you an appreciation for how specialists have to act like detectives, piecing together a timeline rather than just reacting to the most terrifying symptom.
Well, the body never lies, but it does speak in code. If you know the grammar, if you know that blue lips before jerking means one thing and weak arms after jerking means another, you can translate chaos into clarity.
Context and sequencing are everything. And looking at all these bizarre mimics, from breath holding to psychogenic episodes, it leaves you with a pretty profound realization.
Oh, absolutely.
We saw how a purely behavioral tantrum can actually be rooted in a physical lack of iron. We saw how a teenager's psychological trauma can perfectly mimic a neurological short circuit and how both can exist in the exact same brain.
Yeah.
And it makes you wonder about the rest of our lives. How many other conditions, whether it's chronic pain, anxiety, or even just interpersonal conflicts, are completely misunderstood because we fixate on the loud, dramatic symptom and we just stop looking for the quiet, hidden root cause.
It's human nature, to react to the fire alarm and totally forget to check the wiring.
We see the jerking muscles, and we forget to check the pulse or ask about the stress. Well, now that we know how to spot the fakes, the only logical next step is to examine the real thing. Next time, we're going to dive straight into true epilepsy and ask what actually triggers the electrical storms in the first place. Until then, just remember, sometimes the most terrifying things in life just require you to take a breath, check the context, and jiggle the mouse.